12 early signs of cancer. Cancer is a disease that affects millions of people around the world each year, with early detection being crucial for successful treatment. Today, we will discuss 12 early signs of cancer that you should not ignore. By recognizing these symptoms and understanding which type of cancer they could indicate, you can take necessary steps to seek medical attention and potentially increase your chances of a positive outcome. Just a quick note, we are not doctors, and the information provided should not be taken as medical advice. This video is solely for informational purposes. Now let's delve into these 12 warning signs and learn more about the possible cancers they could be associated with. Number 1. Changes in bathroom habits. Changes in bathroom habits should not be overlooked, as they can be early indicators of serious health issues, including several types of cancer. Specifically, colon, prostate, or bladder cancer may manifest through various alterations in one's usual bathroom routines. Warning signs to watch for include persistent constipation or diarrhea, a noticeable shift in the consistency or size of stool that lasts more than a few days, the presence of black or red blood in the stool, or stools that appear black and tarry. Additionally, an increase in the frequency of urination or the presence of blood in the urine can also be a red flag. These symptoms, especially when they persist or are accompanied by other worrying signs, necessitate prompt medical attention. Number 2. Bloating. Bloating that persists for an extended period, especially when lasting more than 2 weeks, should not be dismissed as a normal part of digestion or menstrual discomfort. This symptom, particularly when it does not subside with changes in diet or over-the-counter remedies, may be an early warning sign of ovarian cancer. Persistent bloating can also indicate the presence of gastrointestinal cancers, such as those affecting the stomach, colon, or pancreas. Ovarian and gastrointestinal cancers may not present with symptoms in the early stages other than subtle changes like bloating, making it critically important to monitor. It's crucial to recognize that bloating, especially when accompanied by other symptoms such as abdominal pain, fatigue, or changes in appetite or bowel habits. Number 3. Breast changes. Breast changes are significant indicators that should prompt immediate medical consultation. Any new lump, whether painful or not, warrants attention. Similarly, noticeable alterations such as dimpling of the skin, discoloration, changes in the shape or size of the breast, modifications around the nipple area, or the occurrence of unusual discharge represent potential warning signs of breast cancer. While these symptoms can sometimes be linked to benign conditions, it's crucial to rule out cancer as a cause. Breast cancer is predominantly found in women, but it's important to remember that men are not immune to this disease. Detecting breast cancer early significantly improves the prognosis, emphasizing the importance of vigilance regarding any changes in breast tissue or appearance. Before we dive into the next sign, don't forget to hit the subscribe and like buttons if you haven't done so yet. Your support is crucial in helping us keep creating valuable content for you. Number 4. Chronic coughing. A cough that lingers for more than 2 weeks, particularly if it's a dry cough, might be more than just an annoying symptom of a common cold or allergies. This type of persistent coughing could be a critical early indicator of lung cancer. Often, people might dismiss it as something less serious, especially if there are no other noticeable symptoms. However, when a cough does not resolve with typical treatments or is accompanied by other symptoms such as shortness of breath, chest pain, or unexplained weight loss, it's crucial to seek medical evaluation. Lung cancer is notorious for being asymptomatic in its early stages, making a prolonged cough one of the few initial signs that can lead to an earlier diagnosis. Ignoring this symptom can delay detection and treatment, significantly impacting the effectiveness of the intervention and overall prognosis. Number 5. Abnormal periods or pelvic pain. While occasional irregularities in menstrual cycles or mild cramping are common, persistent abnormal periods or significant pelvic pain should not be dismissed. These symptoms may indicate underlying health issues, including the possibility of cervical, uterine, or ovarian cancer. Experiencing severe or unusual menstrual cycles, spotting between periods, or pelvic pain that does not align with your normal menstrual symptoms warrants a medical evaluation. Recognizing and addressing these signs early can be crucial for the diagnosis and treatment of potential cancers affecting the reproductive organs. Number 6. Chronic headache. A persistent headache that defies typical treatment efforts and continues for more than 2 weeks may be a sign of a more serious condition, such as a brain tumor. While headaches can have many causes, ranging from stress to changes in vision, those that are unrelenting and resist standard remedies such as over-the-counter pain relief medications should be taken seriously. Brain tumors can press on nerves and blood vessels inside the skull, leading to chronic headaches. Unlike typical tension or migraine headaches, those associated with brain tumors may not have a predictable pattern and often worsen in the morning or when engaging in activities that increase intracranial pressure. Number 7. Difficulty swallowing. Difficulty swallowing, medically known as dysphagia, can manifest as a feeling that food is stuck in your throat or chest, or it can be a general challenge in swallowing over a period extending beyond 2 weeks. This symptom might seem minor or easy to dismiss as related to less serious health issues. However, persistent or progressive difficulty in swallowing should raise concerns and prompt a medical consultation. It is a potential early sign of various cancers, including those of the throat, lung, or stomach. Throat cancer can directly affect swallowing by causing changes or obstructions in the structures involved in the process. Similarly, lung cancer can indirectly lead to swallowing difficulties through pressure on the esophagus or other mechanisms. The persistence of this symptom, especially when accompanied by other signs such as unexplained weight loss, pain during swallowing, or a persistent cough, is an indicator of serious problems. Number 8. Excessive bruising. When bruises appear frequently and in unusual areas without a clear reason, it may signal an underlying health issue that requires attention. Excessive bruising, especially in parts of the body that have not been subjected to any known trauma, can be a symptom of blood disorders, including various types of blood cancers such as leukemia. Blood cancers affect the production and function of your blood cells, leading to an increased tendency to bruise or bleed easily. This happens because the cancerous cells often interfere with the normal production of blood components responsible for clotting, resulting in a reduced ability to prevent bleeding. If you notice that you are bruising more easily than usual, or if bruises appear without any injury or with minimal bumps, it's crucial to consult with a healthcare professional. Number 9. Frequent fevers or infections. Experiencing frequent fevers or falling ill with infections repeatedly could be a red flag for an underlying problem with the immune system, potentially caused by cancers such as lymphoma or leukemia. These types of blood cancers can significantly impair the body's ability to fight infections by affecting the production and function of white blood cells. When the immune system is compromised, even minor infections can become recurrent and more difficult to treat. Furthermore, fever is a common symptom associated with these cancers, often manifesting without an apparent infection or other identifiable cause. If you find yourself dealing with ongoing fevers or infections that seem to recur more often than expected, it's essential to consider these symptoms as warning signs. Number 10. Oral changes. Oral changes, such as persistent sores, lesions, or painful areas in the mouth, should never be ignored. These symptoms can be particularly alarming in individuals who smoke or consume alcohol heavily, as they are at a higher risk for developing oral cancers. The appearance of white or red patches inside the mouth, unexplained bleeding, or numbness in the oral region are additional signs that may point towards oral cancer. These changes can occur on the lips, gums, tongue, the inner lining of the cheeks, and the floor or roof of the mouth. It's important to monitor any oral alterations that do not heal within 2 weeks, as early detection of oral cancers significantly enhances the effectiveness of treatment. Engaging in regular dental checkups can also aid in identifying any precancerous conditions or the early stages of oral cancer. Number 11. Skin changes. Noticing changes in your skin, particularly with moles or birthmarks, can be an early indicator of skin cancer and should prompt immediate medical evaluation. The ABCD mnemonic is a useful guide for identifying suspicious changes that may signify melanoma, a serious form of skin cancer. Asymmetry, where the two halves of the mole do not match, suggests an irregular growth pattern. Irregular or blurred borders of a mole, varying colors within the same mole, and a diameter larger than a pencil eraser are all signs that need medical attention. Lastly, any mole or skin mark that evolves over time, whether by growing, bleeding, or changing in any way, should be assessed. Skin cancer is highly treatable when caught early, making it imperative to monitor for these changes. Number 12, postmenopausal bleeding. Postmenopausal bleeding is an important symptom that should not be overlooked, as it can be a sign of significant health issues, including cancer. After menopause, any uterine bleeding is considered abnormal. While there can be benign causes, such as hormonal fluctuations or polyps, persistent bleeding is a concern that warrants medical evaluation. The occurrence of this symptom calls for a thorough examination by a healthcare provider to rule out or diagnose possible malignancies like cervical or cutaneous cancer. These cancers can cause bleeding by affecting the tissues of the cervix or the lining of the uterus respectively. Since early-stage cervical or uterine cancer might not present with other symptoms, postmenopausal bleeding could be a crucial early indicator. Addressing this symptom promptly enhances the chances of successful treatment. Keep in mind, though, we are not medical experts, and this information should not be considered as medical advice. This video is for informational purposes only. If you found this video interesting, I invite you to subscribe and check out our other informative videos on health and wellness.